The moment blood flow stops, chaos erupts inside the brain. Not slowly, not gradually, instantly. Neurons, the brain's fundamental processing units, begin failing within seconds. Not minutes, seconds. The electrochemical signals that make you begin collapsing like dominoes. Your thoughts, your memories, your movements, your personality, all of it running on electricity. All of it suddenly losing power. Within the first minute, calcium floods into dying cells in toxic quantities. This triggers a biochemical cascade that accelerates destruction far beyond the original blockage. Inflammation ignites, spreading outward like an invisible fire through brain tissue. Healthy neurons surrounding the dead zone begin suffocating too. The brain desperately attempts to compensate. Neighboring vessels try to reroute blood. Chemical signals fire urgently. But without the blocked supply restored, the brain is fighting a battle. It cannot win alone. And the region affected determines everything. Everything. A stroke targeting the left hemisphere's language center, known as Broca's area, can leave a person completely unable to form spoken words. They understand every word you say to them. They know exactly what they want to say. But the connection between thought and speech simply no longer works. Imagine knowing your own name, but being unable to say it. A stroke striking the motor cortex paralyzes the opposite side of the body. Right brain stroke, left body affected. Left brain stroke, right body affected. An arm that will not lift. A leg that drags. A face that falls. A stroke reaching the frontal lobe can alter personality so profoundly that families describe sitting beside someone they no longer fully recognize. The same face, the same voice, but a different person. Looking back, modern medicine does have weapons against this destruction. A powerful clot-dissolving drug called TPA, tissue plasminogen activator, can restore blood flow if administered within 3 to 4.5 hours of symptom onset. Miss that window, and the option is gone forever. A surgical procedure called mechanical thrombectomy, where neurosurgeons physically navigate a catheter through blood vessels to the brain and mechanically remove the clot, can sometimes be performed up to 24 hours after onset in select patients. But again, every hour of delay worsens the outcome. Studies show that for every 30 minutes faster treatment begins, survival improves by 14%. The faster treatment begins. The more brain survives. The more brain survives. The more of the person survives. Delay by 1 hour, and the outcome measurably, permanently worsens. This is not a metaphor. This is not a warning designed to frighten. This is neuroscience, and it changes lives in the time it takes to decide whether or not to make a phone call. For most of recent history, stress was treated as a psychological problem. Something invisible, something personal, something people simply needed to manage better. Take a walk, breathe deeply, meditate, disconnect for the weekend, and everything will be fine. But neuroscience, over the past 2 decades, has revealed something far darker, far more urgent, far more physical than anyone wanted to believe. Chronic stress is not just in your head, it is actively destroying your body. When the brain perceives a threat, real or imagined, it triggers the release of 2 powerful stress hormones, cortisol and adrenaline. These hormones were designed by evolution for one purpose: short, explosive emergencies. A predator, a physical danger, a moment of crisis. The hormones flood in, you respond, the threat passes, and the body recovers. But what happens when the threat never passes, when the deadlines never stop, when the financial pressure never lifts, when the notifications never go quiet, when the anxiety never fully resolves? The hormones keep flooding, day after day, week after week, month after month, year after year. And the body, designed for recovery, never gets it. Here is what chronic cortisol and adrenaline do to the cardiovascular system. Over time, silently, irreversibly, heart rate elevates, not occasionally, but chronically. The heart works harder every hour of every day. Blood pressure spikes repeatedly. Each spike etches microscopic damage into the delicate inner walls of arteries. Damage so small it cannot be felt. Damage so consistent, it accumulates across years into something catastrophic. Inflammatory proteins flood the bloodstream. C-reactive protein, interleukin-6, fibrinogen, These markers, measurable in a blood test, indicate that the body is attacking itself from within. Arteries become inflamed, vessel walls thicken and stiffen, plaques begin forming. The highway system of the body, slowly, silently, closing down. Sleep, the brain's single most powerful repair mechanism, fragments under chronic stress. And without deep sleep, the brain cannot clear the inflammatory waste products that accumulate in neural tissue every single day. Every sleepless night leaves the brain slightly more vulnerable than the night before. And then there is the modern European reality. Cities designed for maximum productivity and minimum recovery. Push notifications arriving at midnight, financial anxiety with no clear resolution, political instability feeding a constant background hum of dread, social media creating relentless comparison and inadequacy, loneliness, despite being surrounded by millions of people, noise, crowds, speed, pressure. The human nervous system, wired over millions of years of evolution for cycles of stress and recovery, was never designed for this. Never. Yet millions of people across Europe now live in permanent activation. No genuine rest, no true recovery, just pressure, building upon pressure. While the cardiovascular system absorbs the cost, silently. Neuroscientists describe it this way: the body keeps score. Every unresolved hour of chronic stress, every sleepless night, every cortisol spike without recovery, recorded, accumulated, stored inside the walls of your blood vessels. Until one day, the account comes due, and the body, which absorbed everything in silence for so long, simply cannot compensate anymore. Lucas survived. The ambulance reached him in time. The treatment window was not missed. The clot was dissolved. He survived. But in the days that followed, Lucas discovered something nobody had prepared him for. Survival is only the beginning. He woke in the hospital 3 days later. The doctors called it a success. The nurses smiled. His family wept with relief beside his bed. But when Lucas tried to speak, the words came out wrong. When he tried to lift his right hand, it trembled uncontrollably. When he tried to remember the name of his oldest friend, it was simply gone. This was not the ending. This was the new beginning. And it was harder than anything Lucas had ever faced. 7 months after his collapse, he still struggled to complete sentences. Words would form in his mind with perfect clarity, then dissolve completely before reaching his lips. His right hand trembled during simple tasks, holding a pen, lifting a glass, buttoning a shirt. Tasks he had performed 10,000 times without thought, now required total concentration and often ended in failure. Exhaustion arrived without warning. Not tiredness, neurological fatigue, a crushing, total exhaustion specific to brain injury, where thinking itself becomes physically draining, where a 10-minute conversation requires a 2-hour recovery. But it was the emotional aftermath that surprised him most. Depression following stroke is not weakness. It is not self-pity. It is not a failure of character. It is a documented neurological consequence of brain injury, damage to neural circuits that regulate emotion, motivation, and self-perception is extraordinarily common after stroke. The brain that once generated optimism, drive, and identity is now working with damaged infrastructure. Many survivors describe it as grieving a loss they cannot fully explain, because the person they lost is partly themselves. And behind Lucas, as with hundreds of thousands of stroke survivors across Europe, was an entire family, quietly, permanently transformed. His partner, who had been his equal, became his primary caregiver overnight. Their relationship, once built on mutual independence, restructured completely. No conversation about it, no choice, just the new reality, arriving without warning. His children absorbed fear they were too young to name. They learned to read their father's silences differently. They learned to celebrate things that were once invisible: a full sentence, a firm handshake, a laugh that came easily. Friends who genuinely meant well did not know what to say, and eventually stopped calling. The career Lucas had built across 20 years was placed on indefinite hold. The identity woven into his work, his pace, his capability, his professional self, restructured overnight. By 12 minutes of interrupted blood flow, rehabilitation began. Physical therapy, rebuilding the pathways between brain and body. Speech therapy, reconstructing the architecture of language. Cognitive therapy, retraining memory, attention, and executive function. Progress came, slowly, agonizingly slowly. 2 steps forward, 1 step back. A good week followed by a week of regression. Small victories celebrated with disproportionate joy, because after stroke, every small victory is enormous. And despite remarkable advances in neurorecovery science, some losses became permanent. Some words never fully returned. Some movements never completely recovered. Some aspects of the person Lucas was before remained only in photographs and other people's memories. This is the reality that neurologists emphasize with absolute urgency. This is why prevention carries such extraordinary weight. This is why every warning sign matters so profoundly. Because once brain tissue dies, medicine has limits. And those limits are measured in the minutes people hesitate before making a phone call,